Who is at risk for oxygen desaturation? Have you ever wondered who might be at risk for oxygen desaturation during sleep? This is a vital question, especially when considering sleep apnea. Oxygen desaturation occurs when blood oxygen levels drop, often due to interrupted breathing during sleep. Let's break down who is most likely to experience this. First, obesity is a significant risk factor. Extra body weight, particularly around the neck, can lead to airway obstruction. This makes it harder to breathe while sleeping, increasing the chances of oxygen desaturation. Next, studies show that men are more frequently affected by obstructive sleep apnea and related oxygen desaturation events. If you are male, it's essential to be aware of this increased risk. Age is another factor. As people get older, the likelihood of developing sleep apnea rises, which can lead to more frequent drops in oxygen levels during sleep. A larger neck circumference can also play a role. A thicker neck may narrow the airway, making it easier for obstructions to occur. This can lead to more episodes of oxygen desaturation. Family history should not be overlooked. Genetics can influence airway anatomy and control issues, making some individuals more susceptible to sleep apnea and its associated oxygen drops. Now, let's look at specific factors that can increase the risk for oxygen desaturation. The severity of sleep apnea is crucial. More frequent and longer episodes of apnea or hypopnea can lead to deeper and longer-lasting drops in oxygen levels. Chronic intermittent hypoxemia, which refers to repeated cycles of low oxygen during sleep, can lead to cardiovascular and metabolic issues. This makes it even more important to monitor oxygen levels during sleep. Interestingly, children can also experience oxygen desaturation due to sleep apnea. Pediatric sleep apnea has been linked to risks such as hypertension, making it vital to identify and treat it early. Even mild cases of sleep apnea can lead to significant oxygen desaturation if the events are longer and deeper. This means that even those with mild symptoms should not ignore the potential risks. During an in-lab sleep study, known as polysomnography, oxygen desaturation is closely monitored. The oxygen desaturation index measures how often blood oxygen levels drop by a certain percentage, typically 3% per hour. This measurement helps assess the severity of the condition. Individuals with risk factors like obesity, male sex, older age, and larger neck circumference are often prioritized for sleep studies. They are more likely to experience significant oxygen desaturation during sleep. By understanding these risks, healthcare providers can better assess and manage sleep apnea. Identifying individuals at risk allows for targeted interventions to prevent complications related to low oxygen levels during sleep.